All right. Well, happy to see you all here today to join us for our conversation, our presentation on youth caregivers and ALS, understanding the needs, impacts, and the support that's available for the youth. So today we have Jennifer Thomas. She is a master level social worker, executive director of Hope Loves Company. And if you're not familiar with that organization, I hope you'll have a better understanding of what is available from them after today's presentation. So Jennifer is a social worker, an organizer, and a passionate advocate for the community. She's a Kansas native, yay. And Jennifer holds her Bachelor of Social Work from Kansas State University and her Master's of Social Work and International Policy from Columbia University. Jennifer has worked in the nonprofit and public sector for more than a decade. She served in programmatic advocacy and management roles. She developed programs that were funded by the CDC for young breast cancer survivors at Sharsheret, and served as the CMO for Girl Scouts, where she led advocacy initiatives that included a collaboration with the Office of the First Lady, Michelle Obama, and her initiative, Let Girls Learn. So we're really happy to have Jennifer here today to talk with us and share her information and knowledge. So thank you.
Thank you so much for having me. It's great to be with folks that know Kansas. I'm out on the East Coast now, and I am the lone Kansas out here hopping around in New York City and in New Jersey. So it's always good to be with people who understand what the plaza is and know that K-State's different than KU. So it's nice to be in sort of a virtual home. Just a little bit about me before I jump into the conversation. I'm fairly new to Hope Loves Company. I've been with the organization a little less than a year. I came from the National Association of Social Workers, where I was recently their chief executive officer. So I'm new to the ALS space in a lot of ways, but not to the youth mental health space in any way, shape, or form. And I'm excited to chat with you all a little bit about what we do and what we're seeing trends in the field, and particularly with the youth. I'm going to go ahead and share my screen. You're welcome to jump in the chat box if you have questions during the presentation, and I will do my very best to try to monitor both if I can. Let's see. I might not be able to. Might be asking too much of me on a Tuesday morning.
I'll help monitor the chat for you if something's popping in.
Great. I'm going to assume you can all see my screen. Is that correct?
Yes.
It's a little wonky. Technology is not my friend today. So Hope Loves Company, just a little bit about us. We are a little bit over 10 years, almost 11-year-old organization. We were founded in New Jersey by a woman named Jody O'Donnell, and she was a mother, a young mother. She had a toddler child when her son was diagnosed with ALS, and she very quickly came to understand that the needs of the kids in the ALS community were being unmet. She founded Hope Loves Company to sort of wrap her arms around the youth in this space, and the organization has really continued to grow and evolve over the last 10 years. Her husband passed away several years after his diagnosis, and she did remarry a gentleman who had also lost his wife to ALS, and they had young children. So the growth of our organization has really mirrored a lot of their own personal lived experiences and understanding their kids' experiences and trying to solve for some of those. We started out with a camp in New Jersey, and we've grown to service the entire United States. And we'll talk a little bit about what that's looked like and how we've continued to grow every day. So a little bit about today's conversation. I wanted to talk a little bit about who are children caregivers. And I think that's can be sometimes a triggering term for people to think about. I want to talk a little bit about the challenges recognizing youth caregivers, some of the risks that are faced by the young caregivers, some of our key strategy areas, and then talk a little bit about the interventions and the outcomes that we're seeing with Hope Loves Company. So who are children caregivers? And I talk about this a lot in the work. I was just at a conference and I said, we focus on children caregivers, and people can have sort of a visceral reaction to that. because that can mean a lot of things. And also, people can think that children aren't serving as caregivers. And I think for those of us in the ALS community, we know that children are doing caregiving activities, and it looks and feels a little bit different for every family. And we're going to talk a little bit about what that looks like. Broadly speaking, there are about 5.4 million child caregivers under the age of 18 in the United States. That is based on research that came out of 2021. They are filling unpaid caregiving responsibilities of family members or loved ones, most typically with, degenerative diseases or cancer, et cetera, disability, chronic illnesses sometimes, but most of it is a terminal illness. They often carry out on a regular basis, significant, substantial caring tasks and assume a level of responsibility, which would often be associated with an adult. And for the children that we see come through our programs, that can look like anything from helping their loved one or a parent get dressed, daily living activities, sometimes medication management, which is something that is always hard for people to hear and think about, depending on your family composition. Mobility issues, helping them just perform daily tasks. And a lot of times we hear that children are also performing, very complicated tasks for their family, such as communication. So they're translating for people, they're helping be that bridge and that voice for parents who might not be able to communicate as easily with other adults, and they're serving in that capacity. And what that looks like for every family is a little bit different, depending on the family composition. A single family household where, there's one child and one adult might look very differently than a household with, an adult caregiver as well. But we are seeing that children are performing these very substantial tasks in their house with a loved one living with ALS, and that their needs are continuing to grow. Some of the things that we see are seeing in this space are that health disparities, health crisis, and COVID have exacerbated this issue. There are no shortage of challenges right now in children who are caregivers. Just a second. So strange. My slides are blinking in front of me, so I apologize. We're certainly seeing the needs of children who are caregivers, their needs rise. There's an unprecedented challenge in the nation, certainly at the heels of COVID. There are single parent households, single grandparent households, and thereby really increasing the number of children who are performing caregiving tasks in their day-to-day lives. There are also compounded difficulties. Children who are acting as caregivers and performing those tasks are having significant impacts on their own physical health, but certainly their mental health as well. Often these caregiving activities come at a cost to them. They're neglecting their own personal health. They're not sleeping as well as they should be. They're not, doing child-centered activities like participating in after-school sports, getting out and just playing, as is really important for children. And, certainly the coming out of COVID and also having a parent or a loved one with a diagnosis such as ALS has a profound impact on their mental health, just understanding what that means for them, what it means for their family, and sort of anticipatory grief in a lot of ways. We're seeing a lot of that today with our youth. There's a study founded by the Gates Foundation, and they said that 22% of young adults who dropped out of school did so to care for a family member. And that really highlights for us the significant impact of caregiving responsibilities and educational attainment. And we're seeing that to be very true for our older adolescents in the ALS space, that often, school might fall wayside as their parent progresses in their ALS journey. The disease becomes more complicated for their family to take care of. And the reasons for educational dropout and that getting put on the back burner can be a lot of different reasons. For single parent households, some of those children are looking for employment to keep the family afloat. We know that ALS is not only a physically devastating, but a financially devastating disease. We're also seeing that children are just not going to school because of the things we just sort of mentioned: the stress, the mental health, the anxiety, the fear of the unknown. And we're also hearing a lot from our children that, there's a sense of time, and they're very aware that they don't have a lot of time with a parent or a loved one with ALS. And so going to school or finishing that just doesn't take a priority right now, because they've got other things that they'd like to focus on, and spending time with their loved ones is a priority. But certainly when you think about the big picture of these young people's lives, that certainly has an impact. If our children aren't going to school, they're not, furthering their education, they're not graduating from high school, that does leave them in very challenging situations as they step into adulthood and the rest of their lives. In 2021, I'm not sure who all social workers here, but if you are, you probably are very well familiar with some of the research that came out. The US Surgeon General issued a report and declared that kids' declining mental health is the crisis of our lifetime. I think that is certainly true. I know that I have a young son, and seeing his peers and how they came out of COVID without any familial health challenges, you can certainly see the impact and see the impact just sort of reverberating throughout all of the schools and the kids in our community. The report also illustrated that youth are reporting more feelings of isolation, stress, and inadequacy. And these findings are even greater in the youth whom are caregivers. It's also very interesting to see the correlation with youth who are not only caregivers, but also other sort of less connected communities. So how do we recognize youth caregivers? Understanding who they are and what their challenges are is incredibly important. There are a couple of challenges and threats. Some of the things that we think a lot about at Hope Loves Company is specifically because our focus is on youth caregivers and then supporting the rest of the systems around them, that the public health systems, educational institutions, and government policy has been very slow to recognize the contributions or psychological setbacks of young caregivers. There's not a lot of people talking about it at all. And I think that's really evident in the ALS space, even just with, the organization that, I'm at. Hope Loves Company is the only organization in the country really providing the support for children who are caregivers to ALS patients. There's not a lot of conversation happening. And while there are some programs and research available to youth caregivers, it's not a conversation that's happening in a lot of professional spaces. I just left a conference for social workers, one of the largest conferences in the country. And I thought, let me just listen to see what's happening in this conversation. And there were no presentations about how mental health professionals, school social workers, healthcare social workers are really trying to wrap their arms around children who are caregivers. And I thought, I haven't heard this conversation in, the 7 to 10 years that I've been going to conferences in my field. And when asking around, no one else has heard this as well. So there's certainly a gap in the public health systems and just educational institutions addressing these conversations. Certainly at scale, there are no supportive programs that offer consistent, meaningful, accessible, cost-free services and interventions to support diverse and at-risk populations. And I'm really excited to talk about a couple of initiatives so that we're moving the needle a little bit in that direction. But it's not, a widely addressed problem. People aren't throwing lots of money at it, and there are no sort of universal catches for this population. Gradually surfacing, there's research terminology, identification, and awareness about this issue. But it's very gradual, it's minimal, people are talking about it, et cetera. And there's a lot more need for us to invest research dollars into this population and understand what those needs are. So what are some of the risks faced by young caregivers? We touched on a few a little bit, but these are the ones that really stand out to us and that we're seeing most predominantly in our space right now. Mental health issues are first and foremost. This is the number one challenge that we see our adolescents arrive with in our space. And we can talk a little bit about how they present this and what that looks like. But we offer mental health programs and monthly hangouts online virtually, and we offer in-person support programs through our camps. And number one, again, mental health challenges, issues, et cetera. And that's one of the things that the parents are asking for resources for, mostly from us. There's also a huge feeling of isolation in children who are caregivers. And that's sort of both by nature of being a child caregiver and also the disease itself, is specifically around ALS. When children are caregivers, again, they're not going to after school activities. They're not going to Girl Scouts. They're not participating in sports. They're really have a very isolated experience and a lot of times. And so they're not finding that natural connection to their peers to find support and to find, some of the joys of childhood and keep those relationships going. The other piece of that we really hear time and again is that even when they do participate in some of those activities, even when there are financial resources to, do after school sports and to do all of those things and that they're able to get to them, there's a disconnect in what the children whose parents have ALS, their lived experience and that of their peers. Because ALS is such a rare disease, it is very, very uncommon for the youth to be able to say, oh, there's someone else in my school who's going through the same situation. They just don't have anyone to connect with who understand what their lived experiences are, what their fears are. They don't have anyone to say, oh, my parent is communicating with the Toby device, or hey, we have this Hoyer lift in our home, or this is why we have the ramp. So the children feel frustrated. We hear that a lot, that they feel frustrated, and it's isolating because their friends or their peers have questions and they're not sure how to answer them, or it's difficult to answer them, or they're just uncomfortable having that continue to be the center of their conversation. So they pull away and they retreat quite a bit. We are seeing an increase in depression amongst our children, diagnosed depression, some exploring medication, certainly mental health, psychotherapy, regular therapy, family therapy, play therapy. We're really leaning into those spaces. There's a lot of stigma that we're hearing from our children as well. It's difficult to be a child caregiver. A lot of pressures, adult pressures being put on you. There's a lot of stigma associated with that. There's also a lot of stigma around just disabilities in general, and having a parent or a loved one who has different physical limitations can be very stigma producing amongst their peers. And the kids are certainly sharing that with us, that there's a lot of stigma around disabilities and, even, mocking of parents. And gosh, kids can be so mean sometimes. I think as we all recall our years growing up, and our kids today are still certainly suffering from that. We see a lot of anxiety in our kids. Our kids are anxious about a lot of things, and it's different depending on the age group of the youth that we're serving. So our younger kids are really anxious about, what does this mean for mom and dad today, tomorrow? How long am I going to have my parent with me? A lot of anxiety about what the future holds. There's anxiety also amongst our older population, and that anxiety is really interesting to see it shift and mold. Often our older adolescents or our young adult population, that's kind of a ever-changing age bracket as young adult ages shift. But their anxiety looks a little bit different. It's anxiety about my future, anxiety about my predisposition, my genetic predisposition to developing ALS. What does this mean for my family as I develop into a relationship, as I seek to get married or start my own family? Do I have any risks associated with my own well-being that I could pass on, or that a spouse might have to care for me? So there's a lot of anxiety in a different way for the older adolescents as they, grow into young adulthood. We are seeing some trends around self-harm as well. And this sort of coincides with the Surgeon General's report that the rates of self-harm and hospitalizations of youth because of self-harm and suicidality are on the rise, and we're certainly seeing that mirrored in our population as well. Couple of other things that we're seeing, certainly discrimination. It goes back to the stigma. We are seeing poor academic performance. A lot of our children are having challenges with school performance, not only because of attendance, but because, again, they're experiencing mental health issues, feelings of isolation. They are depressed, they're managing anxiety, and that can be very difficult for those kids. The other thing that we're hearing from the parents is that, the children are doing fine while they're in school, but they're not able to perform and do their homework and study for exams, et cetera, when they get home. That there's a lot going on in the household and it's very difficult. And because they're performing caregiving activities, then, they don't have the time and the energy or the capacity. And sometimes they're just simply too tired to study, and they're seeing that impact their grades, certainly. We're seeing chronic absenteeism across the board, which connects back to the poor academic performance. Again, healthcare challenges in the house, shuffling to appointments, needing to be gone certainly in sort of rural areas where you have to travel longer distances to ALS clinics, that impacts the entire family. Interestingly enough, we are seeing that since COVID and all of us reluctantly perhaps embracing homeschool, that there are some interesting new shifts that some of the parents who are traveling to, for ALS clinics and to take care of their loved ones, they can lean into the homeschool aspect, and there are some more supports today than there were perhaps 5 to 7 years ago to address for some of that chronic absenteeism. So that's certainly something that we're thinking about exploring. How do we bridge that gap for some of these students to make sure that they continue on with their education during this health crisis? Something that came out and that really stands out to us in the Surgeon General's report was that 1 in 3 high school students said that they had experienced persistent feelings of sadness and hopelessness in the past year. They couldn't participate in regular activities. And that was a 40% increase since 2009. And that certainly holds true for our community as well. And those rates are even a little bit higher. They're higher than the 40%. We're seeing about a 43 to 45% response in that. And I think that just comes with, being a child caregiver. You've got the already challenging landscape of growing up and being a child and adolescent and growing into adulthood and all that comes with it. But certainly having a caregiving role makes it even more challenging. The vulnerable populations are even further marginalized. And this is really important for us to talk about because it's something that we're focusing a lot of our time and energy on. The youth caregiver populations are already a precarious status. We know that they are already experiencing real challenges. However, the LGBTQ+, Black, Latinx, Asian, Indigenous, and immigrant groups have increased risks, and deepened inequalities atop of an already marginalized status. So I think about my community in particular. I happen to reside in a predominantly Caucasian community where there are 8 children of color in my son's entire school district. So, they're already a marginalized population. And for those families who are facing ALS, it's even further isolating for these families, and the resources and support are not readily accessible. I think the other thing, and that's this conversation that's really important, is that, kids are looking to identify with people who look like them and also have been in their same situation. So, when kids arrive in our space, we can typically match them up with, a mentor or somebody who's been through the similar situation. But if an Indigenous child shows up, we don't necessarily always have that one-to-one match. Somebody who looks like me and has been in my shoes, and that can be really difficult for the children to find that connection and that cultural connection, and even understand just some of the nuances of, how culturally their families handle a diagnosis, which is really important. Going back to something we talked about just a couple of minutes ago, I think there's also a need for education in the professional space, and we're certainly seeing this. Understanding the cultural differences and how families handle ALS and healthcare issues. And something that I really brought over from my work in the breast cancer field is I work with predominantly Jewish families. So understanding the cultural, nuances between a man and a wife and a family purity laws and things like that, and how they impact a healthcare setting or treatment setting and things like that, also really need to apply in the ALS space. And, I talk a lot with, Indigenous families about their beliefs in medication and treatment and their belief in faith and how that impacts their ALS journey and how they talk about it and how they seek support, et cetera. And we're not having those conversations in the ALS space and in particular with children. So we really do need to work as a healthcare profession and just a support profession to elevate that and to help create spaces that kids don't have to explain their cultural backgrounds or, all of the nuances of their religion and their beliefs, and sort of just be and arrive, and it makes sense to them. The escalating cost of mental health care and privatization of critical mental health resources is a real barrier that we're seeing. And I think for those who have been in the mental health space in any capacity, one of the trends that we're seeing across the board is that because insurance is very difficult to work with, a lot of mental health providers are not accepting or working with insurance. They are going to exclusively private pay. And we can talk about that separately, But the ultimate impact is that, a lot of families in need are not able to access critical mental health services that they need. And for a disease that is so devastating, just physically, but also emotionally, mentally, and financially as ALS, and we know that ALS often means the loss of both incomes in a household. They simply cannot afford mental health services, let alone mental health services for the individual living with ALS, the caregiver, and the child. And that could be, upwards of $1,000 a week, depending on where you live. So there's some real barriers that we're seeing emerge in this space, and they're further compounded by in marginalized communities. So that's a little bit depressing when we think about all of these things and we think about the impact to the youth and the children in our community. So hopefully we're shifting to a little bit more positive conversation with some of the key strategy areas. There's certainly changes needed in both domestic and professional settings. And we'll talk a little bit about Hope Loves Company and how we're trying to do that and the services that are available to you and your network. We see and we try to see every day a brighter future, which can be really difficult. We are trying to recognize, identify, and acknowledge these issues in the settings and call them out and really elevate the stories and the needs of our profession and sort of be the champion and the voice for the change that's needed. We're looking to expand access to mental health professionals and resources so that they can recognize, handle, and gain insights into this population, educate youth and adults about youth mental health, providing access to art and music therapy, peer connections, and really trying to help the youth in this space understand how to manage their stress, improve their healthy lifestyles and coping techniques as they journey on in their ALS journey. So what are some of the interventions and outcomes? Well, we've got a lot that we're doing here at Hope Loves Company. We're doing a lot of educational webinars, and this speaks to something I was talking about, just the need to educate the broader community, parents, educators, social workers, youth mental health specialists, et cetera, about the importance of supporting youth caregivers and youth caregivers in the ALS space. I would also say that, Hope Loves Company has really started to invest in educating about just generally what ALS is. So often, the supports that surround our children, the children aren't going to the ALS clinics. They're not going to the doctor's appointments. They're not going anywhere. So sometimes the first point of contact, that we might have with a youth is from a school, and they don't understand ALS at all. So we're really wanting to, as an extension of our desire to help the children navigate this, really try to educate and empower all those who might be in contact with those children about what this looks like. Provide resources to school social workers, help school social workers and support staff, maybe do educational presentations to the school so that the kids find community and there's less stigma and less isolation for those children. We're due in-person and virtual mental health support. I'm so excited to talk about one of the cool things we've just launched, which is a free mental health counseling for youth, adult caregivers, and individuals living with ALS. So we do a couple of things. We do monthly hangouts with mental health professionals. Those are age specific. They're free, they're virtual. Our kids come online, they talk a little bit in age appropriate groups. They engage in a little bit of play together. They really love Kahoots. They talk about music and the things that are going on. We see a lot of dogs and puppies and kittens with our smaller community, but they also get to talk a little bit about what's happening in their households and their families. And then we do some sort of coping strategy or technique with them. Sometimes it's art therapy, sometimes it's musical therapy, sometimes it's a different type of activity like yoga or meditation. So really doing some holistic support of the kids in age groups. And with our new partnership with betterhelp.org or betterhelp.com, our families are able to connect for further support. So if they have a need for mental health services, if their kids want to talk to a therapist, if the adult caregivers want to talk to a therapist, or the individual living with ALS wants to speak with someone, we're able to provide free counseling through betterhelp.com to these families. So we're able to make that warm handoff for a resource that they can provide and sort of hopefully bridging that gap in that financial need and also making sure that the families don't have to leave their house and they have qualified mental health resources at their disposal. Really, the hallmark of our programs where we started is our family retreat camps, and those are starting to happen. We start in May, which are really exciting. These are opportunities. They're 2.5-day retreats for the whole family, and every family uses it a little bit differently. So some kids come to camp on their own. Some kids come with one parent. Some kids come with their whole family and all of their siblings and even their loved one living with ALS. We welcome everyone. All of our camps are accessible. And it's a chance for these families and children to come together in person with others who have been in their shoes, who are in the same journey, to talk about what they're going through, to find that mental health support, to find that essential community who's going to be there and support them, but also really creating some core memories that are positive and lighthearted and beautiful child-centered activities. So it's a little bit of a marriage of traditional camp stuff. So the kids do archery and ropes courses and get to do those fun things like arts and crafts and dress-up shows, and boating, depending on the time of year. And then also really finding that mental health support and coping strategies. This year, our camps, we're really excited, are going to include virtual reality. So we're really thinking about meeting kids where they are. And we know kids, like it or not, they're online, they're in games, and there are a lot of really great resources out there available for free that the kids can use either on their phones or apps or VR, to help them center and calm and to really use in their coping and healing journey. And so we're excited to bring that to them and have them get the opportunity to play around with some of this stuff. So we're excited about that. And so those are some of our key components that we do on a yearly basis and some of the ways that we're looking to intervene and support these children. So these are our programs. We've got Camp HLC, I just talked about. That's our traditional weekend-long camp. Right now, we're registering for New Jersey and Massachusetts. California will open up soon, and we have a new camp coming in Arizona this year. If we can find some funding in Kansas, I'll come to Kansas City. But we're really trying to expand our camps and think just strategically about, what our camp model looks like and where we should be having camps. And these camps are free of charge to all of our families. We do also have travel scholarships available. So if you have families who don't have a camp in their state and want to come to a different location, we do have those opportunities available. Our Beyond the Bunk program is our monthly hangouts, as I just spoke about. We also do something called Hugs of Hope. These are packages that anybody newly diagnosed can come online and they can fill out a Hugs of Hope package. They're really just resources and a warm, fuzzy hug to kids whose parents may have been diagnosed or loved ones recently diagnosed with ALS. They have goodies, sometimes goodies and cookies and books, arts and crafts and t-shirts, and we send those directly to the children so that they have sort of a soft touch point in their ALS journey and a way to welcome them into the HLC community if they so desire. We do a lot of community outreach and events, so you'll see us often at fun runs and walks and things like that. If you think that might be something you'd love to partner with us on in your community, we'd love to. We also do parent meetups. We do know that ALS affects the entire family, and our parent meetups are once a month. They're led by our founder still, a mom who was on the journey with her children. We do bring in mental health professionals. We discuss the challenges, tips for caregiving, parenting, living with someone with ALS, all of the things that come along with being a caregiver, an adult caregiver, we're there for. And that space is really beautiful that the parents can find support in one another and talk a little bit about how did you introduce this device to your child? What did you experience at this point in the journey? When did you talk about this? And they can really support one another as we all support the children. We have partnerships with Purpose, which we're really excited about, the betterhelp.com, which I just spoke about. And we just launched a new needs assessment for the children and caregiving community. It's being done with our partner called Lodic AI, and they are using AI to capture the stories and the needs of this community through a storytelling app. So I'll share that with you. And if you'd like, you can share it with your families. It's really cool. They go online, they tell the story to a camera. They just ask a series of questions and they respond. At the end of that, the AI takes it and synthesizes the data. It's de-identified. We never get the identifying information. But at the end of that activity, the participant also gets a piece of artwork that was created by AI that is a visual representation of the story that they just told. And so all of the artwork is really different and unique, and we've played around with it. And it's a pretty interesting new tool, and we're excited about these types of partnerships. So those are our key programs that we're offering. We do have one other that's not on the list because it's not up and running yet, but we're really excited about it. We have a program we're developing called Kids Are Curious. One of the things that we really came to understand very early on, or I came to understand early on, is that kids have questions about the devices in their households. The Hoyer lifts, the Toby devices, the wheelchair ramps, the accessible vehicles, all of the different adaptive devices that might come into your home as you have a loved one living with ALS. So we're partnering with manufacturers, we're partnering with the adaptive devices companies, and we're bringing kids together with the devices in a safe space so that they can touch and learn and ask questions. And this will become video content online so that you might not need all of the information all at once, but as your loved one's journey progresses in ALS, there's a resource, and a kid-centered resource that they can watch it. You can show the kids what will be coming into the household. They can hear from other kids the questions that they had and learn a little bit about the journey from a kid's perspective, and hopefully make that a little bit more easy for the children and accessible. And our dream would be for every year us to be having all the kids to come together for a conference where they got to see it in person. But our starting place will be content, at least online, where you could watch with your children on demand. So all of these programs, what are our outcomes? What are we seeing, with the interventions that we're providing and the support services? Well, all of our participants are sharing that there's an increased feelings of community belonging and acceptance, and that's something we're really proud of. This is the first thing that every one of our families will tell us. I felt like I had a community, that I belonged, that it was easy here. And that took a huge weight off my shoulders. Our children, we do use both qualitative and quantitative measurement tools to understand just whether our programs are effective. We do see a reduced feelings of isolation, depression, and anxiety in our kids, going back to all the coping strategies and the tools that we share with them. We're excited to see how the connection to BetterHelp will also help improve that in the next year. We're seeing an increased access to mental health support. Certainly now with our relationship with BetterHelp, that'll be even more clear. And we're see it and hear that we have a cultivation of a safe space and a continuum of care. That no matter where you are on your ALS journey, from your parent being newly diagnosed, maybe with your 5, to sitting on our board of directors as a young adult, and we have that in our organization, that you have a community to support with you throughout your journey for however long you need us, and sort of whatever way you might need us. We also see that there's an elimination of disparities and stigma by ensuring our programs are free of charge for all. And that's really very important to us. ALS, again, devastating disease financially, and all of our programs are free of charge to our families. We work really hard to make sure that we can continue to do that. And we're really grateful for our sponsors who make that possible. We don't want any child or family having to be turned away from any program or participating in an in-person weekend retreat because of their inability to pay. So a little bit by the numbers, we thought we'd share some fun stuff with you. This was 2023, and this predates me, so we're excited to blow these numbers out of the water this year. We had 199 campers last year, which is sort of an interesting trend because you never know, that first year back after COVID can be really difficult. We had over 80 volunteers, 104 parents last year who participated in our programs. We had 5 impact days, which are our corporations. We partner with them. We awarded over $10,000 in scholarships. We do give scholarships to our children for higher education. So we have that program. We sponsored 9 students with that. We had programs in 8 states, and we had family representation from 33 states and 2 international families who participated. We sent out actually over 250 Hugs of Hope. We had 1 virtual camp and 6 family camps, and just a tremendous number of volunteer hours, over 15,000 hours from our volunteer community that really came together to support the children. And it was a very impactful year for Hope Loves Company and the ability for us to continue to serve our kids. The one thing that I did not speak about, which I'll just share really briefly, we were very excited that this year we're also able to offer direct financial support to families. We had a very generous donation, and there's an application on our website so that if you have families who are in need of financial resources for home modifications or assistive devices, things like that, we do have financial scholarships available, and your families can be directed there. It's not a ton of money, just to be super clear, but there are some funds available, and those applications are open. And so we would encourage you to send people that direction if they have needs. And I'm happy to answer those questions for you. These are some of our kids at camp. We've got some fun Hope Loves Company merchandise and gear that the kids love to wear. We're trying to give them fun sweatshirts and hoodies and things like that this year so that they can really support one another and share their love for Hope Loves Company, and also get people excited about what they're up to, sort of support the ALS community in that way. So that's a little bit about what we're seeing in the youth caregiving space, and how we're jumping in at Hope Loves Company. I'm happy to answer questions that you might have.
Thank you so much, Jennifer. I think this was wonderful information to have, and a lot of things that I'm sure a lot of our community is not aware of. So, so if anybody has any questions, you can unmute yourself and speak your question or put it in the chat. I do plan on sending a follow-up email that'll have both the recording of this, and I know one had to drop off early, but we'll also include a lot of the information about Hope Loves Company and the resources and programs they have, so that you can hopefully look into that more and take advantage of that if you have children involved with a loved one that's living with ALS. So wonderful stuff, and such encouraging and growing things that, like you said, I know the beginning to look at the reality is a little tough, but there's a lot of things coming forward that can help in that space, which is awesome.
Yeah, we're very excited about the ability to elevate the needs of the community and the children, and to even expand our understanding as an organization of what supporting the children looks like. It's not just always about the children, it's about also empowering and educating all of those who come in contact with the kids. So, we're going to be doing continuing education resources. We're going to be doing CEUs with different states. Social work interstate licensing compact would help me a little bit with that effort, but fingers crossed that that's coming in 24.
Yeah.
But really wanting to think holistically about how we serve these families, and also making sure that we're continuing to push the envelope and what that means to support the kids. So the evolution of VR is really exciting for us, and we're excited to bring that into camp.
Yes, wonderful opportunities. And I know we had a couple of our staff, they might not be on the call today, who actually volunteered for one of the virtual camps.
Oh, great.
Great experience. And I don't know if that was last year or even the year before, but it was wonderful. And there's just so many good things that when I was working directly with clients, I wasn't even aware of, and love the growth that things are happening. So,
oh, well, we welcome volunteers. So if you have volunteers and you'd like to come volunteer, or you'd like to check out camp, we are an organization, our camps welcome our volunteers, and we definitely need the support. So you're welcome to email me.
okay, wonderful. I'm not seeing any questions come through, so one last call for if there's any questions, and otherwise we'll sign off. So
yep. And I would say just one thing. One of the questions I do get is, how can we connect our families to the free mental health services, right? The betterhelp.com. So we are in a conversation with your national organization. We're hopeful that we'll be able to provide some really clear guidance and how that partnership will look like. We know that it's a resource. We know that you need it. We want to make sure that we're expanding it to everyone. So we really look forward to partnering just nationally with ALS, so that we don't have to turn anybody away just because they might not have children or children in our program. So I would say stay tuned. I anticipate more to come out in the next week or so. So we'll keep you updated.
Well, like Jennifer said, this is a brand new initiative that they just announced. So yeah, a little patience to get all the details to everyone about how you get connected with that. But we're so excited that, I mean, that's a tremendous needed resource. So it's really exciting. So,
Well, we look forward to sharing it with you. And if you guys have any questions, I'm welcome to call me or shoot us an email. We're here to help.
and I'll include contact information along with all the information about Hope Love companies and their programs. So
Great.
thank you so much, Jennifer, for being with us
Thank
today.
you.
All this information. I think it's wonderful. I also, to let you guys know, our next program in May is going to be about genetic testing and, more importantly, even genetic counseling. What do these genetic tests even tell you? When would you want to consider them if you're not the person living with ALS, and why genetic counseling is important. So we'll look forward to that next time, and I will send you some more information about all this, all of these wonderful programs. All right, we're getting some thank yous in our messages here. So thank you so much, Jennifer.
Thank you all. Have a good day.
You guys have a good day. Bye.